Hello, everyone, and welcome to KT Connects, a monthly knowledge translation skills and best practices webinar series co-hosted by Arthritis Research Canada and Michael Smith Health Research BC. My name is Cody Primo, and I'm a postdoctoral fellow working with Arthritis Research Canada and through the University of British Columbia. And I will be the host for today's session. Now, a few things to note before we get started. Please use the Q&A dialog box to ask questions for the speaker at any point during the webinar. These questions will be asked by myself to the speaker in the last 15 minutes of today's webinar. Now, the chat box is enabled and is intended for you to share your thoughts with fellow participants and the organizers. And to be safe, please do not share any personal information in this chat box. This webinar is being recorded and will be made available on Health Research BC's website after today, sometime next week. And if you use social media, please feel free to post content about today's workshop and anything about this series using the hashtag KTConnects. And before we begin, we want to acknowledge the Indigenous peoples who are the stewards of the territories from which we are located today. We recognize Health Research BC and Arthritis Research Canada are situated on the traditional, ancestral, and stolen territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations, known colonially as Vancouver, Canada. From coast to coast to coast, we want to acknowledge all the Inuit, Métis, First Nations, and Indigenous peoples who have called Turtle Island home for many generations. Our aim with KT Connects is to serve as a catalyst for collaborative and collective learning, fostering meaningful discussions, engagement, and partnerships along the way. As we gather to have these conversations, let us also consider how we can actively contribute to the vital process of decolonization in our respective fields and daily lives. Now, please feel free to provide your own personal acknowledgements or commitments to reconciliation in the chat box. This year for KT Connects, we are focusing on open science, a growing global movement aimed at advancing solutions to increasingly complex, interrelated challenges. It does this by making changes to research practices and processes so that scientific inputs, outputs, and processes are freely available to all with minimal restrictions. Knowledge translation is one important component of national and international open science frameworks, which is why the aim of KT Connects this year is to foster dialogue with the research community in BC and beyond about the benefits and challenges of open science, and also to highlight an array of perspectives from scientists and scholars at the forefront of this movement in British Columbia and across Canada. If you missed the first webinar in this series, we encourage you to watch it for an overview of open science from the Canadian and international perspectives. You can find it on the Health Research BC website, along with two others we've hosted in the series so far, and many others from the past 7 years with KT Connects. Today, I have the pleasure of introducing our wonderful speaker, Dr. Femke Hoekstra, who will be talking about transforming spinal cord injury counseling with open science and integrated knowledge translation. Now, Dr. Hoekstra is an assistant professor in UBC's Department of Medicine, Division of Social Medicine, and an investigator with the Center for Chronic Disease Prevention and Management in Implementation Science. Dr. Hoekstra holds a Doctor of Philosophy from the University of Groningen in Implementation Science, Rehabilitation, and Physical Activity Promotion. Her research program focuses on improving health services and care for equity-deserving groups in rural, remote, and isolated communities. She studies implementation processes of health innovations in real-world settings. And so without further ado, Femke, over to you.
Thank you so much for that wonderful introduction. Good afternoon, everyone. Thank you for joining me today, and thank you for having and thank you me and having this opportunity to present today about my work on spinal cord injury physical activity counseling. Before I start, I would also like to acknowledge that I'm calling in today from the unceded territory of the Silk Okanagan people, and I feel very thankful and grateful to have had the opportunity to learn, play, and live on those beautiful lands for the past 6.5 years. And if you haven't done already, please share. Feel free to share and acknowledge the original caretakers of the lands that you are joining today as well in the Zoom. And in my own journey of learning more about the history and culture of the indigenous people, I came across a website on the UBC. It's called Time and Place, and I have it here on the slide. And that I really wanted to share with you today, because this website includes a timeline with UBC key historical moments with indigenous people, and you can click through this timeline and learn about all the things that happened over the years. And one thing that I would like to share with you today that really stood out was in the year 1870, where they say 3/4 of the BC population are Aboriginal, which is about 36,000 people. And that compared to today, the BC population, around 6% is indigenous. So that was something I would like to share with you today. And I hope that we can continue our learning about the indigenous culture and history together and work together towards reconciliation. So just a little bit more about myself. So I'm originally from the Netherlands, where I did my bachelor's and master's in human movement science, as well as my PhD in the area of implementation science and rehabilitation and health promotion. And then after my PhD, I moved to Kelowna, the UBCO, to start my postdoc in research partnerships, implementation science, and health sciences. And I worked with Dr. Kathleen Martin Guinness and Heather Gainforth. And since January this year, I started my position as assistant professor at the UBCO Department of Medicine. And in my research program, I am committed to do high quality research that is relevant and has real world impacts. And I do this really by using theory, framework, and models, meaningfully collaborations with the research users of my work, as well as following the open science practices. And I do this all with a priority on enhancing health equity. So the goal of my research program is to improve health services and care for equity deserving groups in rural, remote, and other isolated communities. So what will you learn today? So I hope at the end of this talk, you will have an understanding of the principles of open science and integrated knowledge translation, or IKT, and understand how they can complement each other. And I will share some strategies on how to apply the IKT guiding principles in the context of projects on developing and evaluating an educational course for health and fitness professionals, as well as I will share examples of how we applied open science practices in these projects. So just a recap about what is open science. So open science is a global movement that aims to make scientific research accessible to everyone, regardless of their level of expertise. And it really focuses on accessibility, transparency, and collaborative knowledge sharing. And it includes, but it's not limited to, publishing open access and sharing data and codes, But in essence, it's really about making scientific knowledge more widely available and easier to access and communicate. And to do this, open science has a set of core values and guiding principles that are listed on this slide. And the values are the core values include quality and integrity. So this is really about ensuring that the science is of high quality and rigorously conducted. Um, the second one is collective benefit, which means that the science is a global public good that belongs to everyone. It's about equity and fairness, so really promoting a fair and equitable access to scientific knowledge. And then the last core value is diversity and inclusiveness. So really with the focus on diversity of knowledge, practices, and research topics. And then to follow these core values, they also developed a set of guiding principles that really help to make the open science happen. I'm not going to discuss all of them in detail, but just a couple of things that I would like to point out. So it is about transparency. It is about equality of opportunities, accountability, a focus on collaboration, participation, and inclusion, as well as the sustainability, so long-term implementation of the work. And then lastly, flexibility. So there's not one size that fits all. So then what is integrated knowledge translation, or IKT? In the context of spinal cord injury research, we define integrated knowledge translation as the meaningful engagement of the right research users at the right time throughout the spinal cord injury research process. And to make a first step to improve the support for meaningful engagement of research users in the spinal cord injury research projects, a strong partnership that was led by Dr. Heather Gainforth worked together to co-develop IKT guiding principles for conducting and disseminating SCI research in partnership. And on this slide, I have the paper that was published on the development process of the guiding principles listed here, as well the website where you can learn more about those IKT guiding principles. So how were they developed? So we used a very systematic and rigorous approach to co-develop those principles. And the principles were informed by 4 data sources: a review of reviews, a scoping review on spinal cord injury specific research partnerships, interviews with IKT champions in spinal cord injury research, and a Delphi study. And finally, we organized a 2-day meeting with the whole panel to co-develop the principles using those data sources. And this meeting was guided by the agreed to instrument to ensure a rigorous and also a transparent approach in the development process. So what are the principles? So there's 8 of them, and we define the principle as a fundamental norm, rule, or belief that represent what is desirable and positive for a person, group, organization, or community. And it really helps to determine the rightfulness or wrongfulness of its actions. And I will now briefly go through each of the 8 principles with you. The first one is partners develop and maintain relationships based on trust, respect, dignity, and transparency. So this principle really highlights the relational aspects of doing research in partnership. The second one is partners share in decision making. So that means that there's not one person on the team that gets to make all the decisions. No, everyone has decision-making power. So it's not like that the panel is established to just tick a box. Then partners foster open and responsive communication. And then number four is about recognizing and valuing diverse expertise and knowledge. And this really means that knowledge doesn't necessarily need to come from someone with a PhD. It comes from lived experience, and that type of knowledge is also valuable. So everyone can bring something different to the table, and that is what makes a partnership strong. So, number five is partners are flexible and receptive in tailoring the research approach to match the aims and context of the projects. So, this really means that you need to understand what everyone's needs are and really be flexible in understanding that. Number six, partners can meaningfully benefit by participating in the partnership. So everyone needs to get something out of it. Um, Partners address adequate considerations. And the last one is about respecting the practical considerations and financial constraints of all partners. So when you may already notice that there's a lot of overlap in some of the principles that I just shared with you on open science and integrated knowledge translation. And there's different ways how they overlap and can complement each other. And I just wanted to highlight a few things that really stands out to me and really helps me in combining those approaches and principles in the work I do. So the first is all about engagement of research users in the research process. So as I mentioned, IKT actively involves your research users like patients, clinicians, policymakers throughout the research process. And open science practice, uh, like for example, by open access publications and sharing your data, will provide these research users with accessible information. So to ensure the information is accessible and useful to them, we like engage them and throughout the research process. So that's really how like both approaches can really complement each other. And related to that, both principles highlight the usability and relevance in different ways. Like open science promotes making research outputs like usable and relevant so that actually everyone can learn about the research you do, can access your findings. And IKT has a strong focus on like doing research that is useful, relevant, and will have can have real world impact by engaging your research users throughout. So from design till dissemination. Um, and then the third one, the transparency and communication. Well, that is something that has been highlighted in both approaches. Um, uh, and like open science does that through like sharing research data, methods, and results openly and transparently. And the IKT guiding principles also highlight the transparency in decision-making processes as well as in the communication among the partners. And then finally, as I mentioned in the previous slides, both open science and IKT highlight the need to be flexible. So there's not like one size fits all. You may need to tailor your collaborative research activities to the needs and the wishes of your partners. And similarly, there's not like your open science practices will look different for each project and for each partnership. So in summary, open science provides the framework for transparent research practices, while IKT enhances engagement and relevance by involving research users throughout the research process. And by conducting and disseminating research using those principles, you will really be able to do research that is more accessible, relevant, useful, and will have and will have real world impacts. So that was the first, that part covered the first learning objective of today. I will now, in the remaining of this talk, focus on some uh, examples and strategies that we used in one of my projects on like co-developing an educational course in the context of physical activity counseling for people with spinal cord injury. And to introduce the project to you, I would like to share a short video about what this project was about. And again, this video we also created to disseminate our work in a more accessible way to people outside academia, which also aligns with the principles of open science and IKT.
Physical activity is vital for everyone, and might even be more important for people with spinal cord injury. However, many people with spinal cord injury do not engage in physical activities because they experience many barriers. Therefore, it's important to support them to engage in physical activity. You can support your clients with spinal cord injury in starting, changing, or maintaining a physically active lifestyle via counseling. Providing tailored counseling can help to reduce the number of barriers and improve physical activity levels in this population. By providing counseling, you'll have the opportunity to change the lives of people with spinal cord injury. But how do you start a conversation about physical activity with your client? And what do you say during that conversation? To answer these questions, researchers, counselors, health professionals, and people with spinal cord injury work together to create best practices for spinal cord injury physical activity counseling. To help you use these best practices in conversations with your clients, we created online training modules about these best practices. After completing this 2.5-hour self-guided training, you'll be able to describe and understand the best practices for spinal cord injury physical activity counseling and understand how to use these best practices in conversations with adults with spinal cord injury. The training is for anybody who provides physical activity guidance or counseling to adults with spinal cord injury. This includes lifestyle or health counselors, peer mentors, occupational therapists, therapeutic recreation professionals, physiotherapists, psychomotor therapists, social workers, kinesiologists, rehabilitation assistants, caregivers, fitness trainers, or other coaches. Join our training today to better support your clients tomorrow.
Yeah, so as you heard in the video, we co-created best practices for SCI physical activity counseling to improve counseling services for our clients with spinal cord injury. And these best practices were created for a diverse group of end users and also guided by the principles of open science and IKT. And the process of the development process of those best practices is also described in the paper that is presented on the slides. And to successfully implement those best practices, there was a need to teach people how to use those best practices in conversations with clients with spinal cord injury. So that was the rationale for our second project, which aimed to co-develop and evaluate an e-learning course on those best practices for spinal cord injury physical activity counseling. And the work that I'm presenting today on this course has been published in the open access journal, BMC Medical Education. So as mentioned, we conducted this project using an integrated knowledge translation approach, and our collaborative engagement activities were guided by the 8 IKT guiding principles that I presented before. And the development process and evaluation of the training course was also guided by the Technology Enhanced Learning Evaluation Framework, also called the TEL evaluation framework. And this is an education framework specifically developed in the context of e-health, learning, medical education projects. And it really builds upon existing learning models, including the Kirkpatrick model. And what is unique about this model is that it focus on both the development process and evaluation. And it has like 7 areas of evaluation activities, which are listed on this slide. So the first one is to conduct a needs analysis and environmental scan, to document processes, decisions, and final products, to test usability, to document key events during implementation, assess participant experience and satisfaction, assess learning outcomes, and estimate costs and usability and sustainability. And really the reason why we selected the TEL evaluation framework as a guiding framework was the focus on like conducting a needs analysis and document your decision-making processes, because that really aligned with our guiding principles on open science as well as IKT. So conducting that needs analysis, really making sure that the training will address the needs, wishes, and preferences of our end users, and documenting our like processes on how we develop the training, and really aligns with the open science practices of being transparent about the work we do. So this slide summarizes the steps we took to co-create the training modules. So first, we identified the relevant scientific evidence and theory on SCI physical activity counseling to inform the content of the training. Then we had several structured meetings with our expert panel on strategies and practical tips for using those best practices. We conducted a survey among almost like 130 potential end users to identify their needs, preferences on taking part in the training. And we also conducted interviews with clients with SCI who received counseling to understand their experience and perceptions. And then the panel members reviewed different versions of the training module throughout the development process. And we also pilot tested the training with end users using Think Aloud interviews. So based on all these discussions and input, the panel decided to co-create online self-guided training modules that are engaging and which the information is presented in different ways. So we used like text, videos, knowledge quizzes, reflection exercises, as well as additional resources for more training opportunities. And the estimated length of the training is about 2.5 hours. So people will learn at the end of the training they will learn to understand the best practices. They will learn how to use them in conversations about physical activity with adults with spinal cord injury, and they will learn SCI specific knowledge on physical activity. As mentioned, the training is for a very diverse group of potential end users, and basically anyone who provides professional guidance or counseling to adults with spinal cord injury on starting, changing, or maintaining a physically active lifestyle. So here on this slide, you will see an overview of the training, and it includes 10 modules. So the first 3 modules are introduction modules on spinal cord injury, physical activity, and exercise, as well as the underlying theoretical frameworks that we use to inform the best practices. Then the next section focuses on how to have a conversation, in which we, for example, discuss principles of motivational interviewing. And then the next modules focus on what to say during a conversation. So people will learn more about common barriers that people with spinal cord injury experience to become physically active, and we will discuss potential solutions to overcome those barriers. And then the final modules include structured counseling examples with flowcharts, as well as a list of additional training opportunities and resources. So then the question is, how did we actually use the principles of open science and IKT in the development process of this training? And here I'm going to share a few examples and strategies that we used to follow those principles. And first of all, we published the paper in an open science journal. And then we also used reporting guidance in the paper to make sure we report on our processes. But then what I really want to highlight today is the use of supplementary files and open science framework. And that is and also in an efficient and tailored way. So we have we included a table of contents so people actually know what's in the supplementary files and open science framework, so they can actually navigate the information in an accessible way. But we also really present, by doing it in this way, we really present the information in layers. So really to tailor it to your audience. So your most important information is presented in the publication. Then you have supporting materials in the supplementary files. And then for those who really want to know more about the details of certain aspects of your project, they can go to our Open Science Framework page for additional documentation. And I can and by doing that, we really address the principles on transparency as well as usability. And I can't highlight enough to include that table of contents, because I have been in situations where I tried to look for certain additional supplementary files on Open Science Framework for other projects, and they're sometimes really difficult to navigate. So then maybe it is there, but you can just really find what you're looking for. So also it's important to think about how you can organize the information in an accessible way when you do use your supplementary files and Open Science Framework. So the next one is about meaningful engagement of a diverse group of partners. So as I mentioned, we use different methods to engage the panel in the development process and to share decision-making power. So we had group meetings, I had individual meetings with people on the team. We did surveys and people had provided written feedback on the training throughout the development process. And this was a really flexible approach. So at the start of the project, I did not know exactly what our engagement would look like, but that's developed over time based on how the projects went. And also to stay accountable, to make sure that we are actually following the IKT guiding principles, I checked in with the team throughout the process through anonymous surveys. So I had the question like, are there any concerns regarding following the IKT guiding principles? And people had the opportunity to provide feedback or comments on our engagement strategy through those anonymous surveys. And then to keep everyone updated, I sent out like throughout the project update emails with like expected timelines on when things would happen, so people can really plan for that. And if it did not work for their schedule, we could like arrange accordingly. And that this approach really addresses like the engagement principles, the flexibility, as well as how we shared decision-making process. And then we did not only like engage a diverse group of partners, but we also reported on members' expertise and collected group level demographics of our team. So in our supplementary file, what you will find is a table with like all the names of our panel members. So these are like the co-authors on the paper. And then like the organization that they are affiliated with, as well as their expertise and background. And this really shows that like we value the different type of like expertise and lived experience and knowledge that people bring to the project. And then we also transparently like reported on our like on a group level the demographics of our team. So similarly as what you do for participants in the study, we collected demographics of our team, because that is like from that perspective we developed this training, and we really want to be transparent in what perspectives we brought into the development process of this training. And in our discussion, we also reflected on the diversity of our team, and really identified like the missing perspectives in our project. And I really encourage people to do that as well in your partnered approaches moving forward. And then another supplementary file where we provided details on how we actually engaged our partners in the project and what we did. And here, this is an example of our layered approach of providing reporting on the engagement strategy. So in the supplementary file, we have this table where we say like in the research phase, we did like online meeting with the panel where we discussed certain topics. And then in the comments, we say, like, if you want to learn more about this strategy, engagement strategy, you can take a look at our open science framework, where we have like meeting materials like the agenda, the slides, and the meeting minutes of this meeting, of this engagement activity. And it is really to like transparently report on our engagement activities, as well as our decision-making process. And then here, if we look at like the decision-making process of like the actual training module, another supplementary file example, how we applied like open science practices in the development process is through like the written feedback that we received from the panel on one of the first versions of the training. And what I did here is identified like the key points of feedback from the panel, and then in like blue I explained about how we addressed that feedback. And that was really also helpful in terms of like not just being transparent, but also staying accountable. And it was also very helpful for our partners, so they actually know how I addressed certain feedback, as well as like sometimes you can't always like address all the feedback, and then you'll explain why you couldn't address it, or why you, yeah. So this was not, is not just like transparent for other people, but also for your team. Um, and Then finally, we had a strong focus on developing an inclusive and accessible course. So the focus on using plain language, and as well as like using knowledge questions without like click and drag function, as that is not always easy for people with limited hand function. And we paid attention to the use of like high contrast colors, and like strategies we used to ensure a more inclusive and accessible course is by like pilot testing with a diverse group of end users, as well as engaging with an inclusive education expert on our team. So then, after the development process, we also evaluated the course using a randomized controlled trial, and we assessed learning outcomes, tested usability, and assessed participant experience and satisfaction levels. And what we found is that participants in the intervention group showed significantly improved knowledge on the best practices for SCI physical activity counseling, as well as higher self-efficacy for using those best practices compared to the control group. And a participant reported very high usability scores, positive learning experience, and high levels of satisfaction when completing the course. So all very positive outcomes. So yeah, in sum, we really we co-created theory and evidence-based training modules to teach counselors the best practices for spinal cord injury physical activity counseling. And we believe that the implementation of these training modules can help to improve physical activity counseling support for adults living with a spinal cord injury. So if you are interested in learning more, you can register for the course. It's online, it's free to access. You just have to like sign up through this link, and then you will receive an email with the link to the course and the login codes. So in summary, I strongly believe that following the principles of open science and IKT will ensure that research it will be more accessible, inclusive, and relevant for those who can benefit from it. And I hope that after this webinar, I provided you with some examples of how you can apply those principles in your research activities and knowledge translation efforts. And hopefully that inspired you to think about research and knowledge translation in a more accessible and inclusive way. So yeah, I would like to thank the Craig Nielsen Foundation for their support in this project, as well as my co-authors for their contributions. And I want to thank all of you again for joining, and I'm happy to take any questions.
Wonderful. Thank you so much. Really appreciate you being here today. Really refreshing presentation, nice parallels, and it's been a theme that's come back in some of the sessions that we've had, and out of my own kind of interest in this area as well, the parallels between IKT and open science and how they really complement each other, and leveraging the subtle differences between each of them and their principles and really trying to maximize those. Love to see that. I have a couple questions myself as well while we wait for some questions to trickle in. So first, I'm wondering, you mentioned that the training that you developed for this course was developed by a large team with diverse expertise and experiences. And I'm sure with that, it brings on, different opinions, different thoughts, and approaches. So how did you navigate, the different perspectives from people in this team, in coming up with a final kind of product?
Yeah, no, that's a really good question. And that is a challenge, I think, in any like IKT project. The more you engage, the more you engage, more opinions and perspectives you have. And in the end, you can't like address everything. Um, so yeah, I think that is the one thing we never like we I like navigated that was really be super transparent. Like I explained in one of the slides. So here, like I will put it on again. In like in the supplementary files, but also in like responding to the team, I shared like these are the things that came up, and this is how I think we should address it. And sometimes it is like, yeah, we can't address it in this project, but we will do this and that to hopefully address your comments in the next project and really explain why um, um, sometimes you can't address. And I think that being transparent about that and report back to your partners um, is really, I think, important. And then you show respect and you really show that you value and take the time to think about it. And then sometimes you have to move forward. And then the question we always ask, like, is there something you can't live with? Because everyone knows that there's so many opinions, and yeah, you have to make a decision because otherwise you are not moving forward. But for me, transparency and reporting back to them.
Yeah, absolutely. And I think, yeah, you've highlighted it really well. The different aspects of being transparent in reporting and sharing that kind of information. And I'm curious to know with so reporting, you talked about how you included a supplementary files with publications and things like that. But for, community members, patients who may not necessarily be accessing publications and scholarly articles. Are there other avenues that you've taken to have this knowledge available, and kind of what does that look like? What are some of the other approaches you've used for that?
Yeah, and in terms of like reporting back to like the partners, community members on the team, I would do like individual meetings and just explain what we did, why we did it, and how we did it, and then ask them like, what do you need? Or what do you like? How do you want to be engaged? So really ask people like how they want to access certain information, and listen to that. Um, uh, and then in terms like that relates to like how we work together and how they provided feedback. And then if like uh um outside our panel, so like our participants, for example, we yeah, like we like one of the examples is like how we shared the work is like through the video, but we also have like all like small infographics. We have like for this purpose we also created this logo that is on this slide, and really have this layout template for like with the little postcards on our best practices. So really create different ways, different like promotion materials. And right now we are in the process of reaching out to lots of organizations across like Canada and North America to share the work we do. And we really ask them like, we think this is relevant to your network. Do you want to share? And then like what do you need for us? Like what kind of material? What will help you to share it in an accessible way for your network? So that's like, yeah, we use different like also flexible and tailored approaches there.
Yeah, no, I like that, especially that like the flexibility and the tailor and having different options available. Very, very important. I'm going to go some of the questions that people have shared, attendees. So the first question said, thank you for a very insightful presentation. When you calculate research costs for grant and or proposal purposes, how do you quantify the cost of broad, intensive, and inclusive IKT activities?
That is a good question. Can I stop share my screen and I can, yeah. Yeah, so I would say number one is make sure you budget for the time that like non-academic partners are going to invest in your project. So make sure you budget for like that you compensate them in an appropriate way. I think that's number one. There's different guidelines on how you can do that. You don't have to like pay your academic partners, but your non-academic partners for sure. You have to compensate them in appropriate way. So that's number one. And then I also would say in terms of like budgeting for additional KT activities. So for example, a graphic designer for like, yeah, creating that logo, for example, or making your products look a little bit more visual appealing and or like to create like an animation video like that, or infographics. Sometimes we also used a technical writer to make your work like more accessible, like plain language. So these are all things that you can take into account when you write a grant and like really budget for that, and you can like use the expertise. Like we are like as a researchers, we are not trained in like plain language writing. We are not trained in like making documents look pretty. There's like other people with like real expertise that can like really support that. But you have to think about it up front. So yeah, really, really good question.
Yeah.
So these are the two things that I would definitely highlight. Yeah, and of course, like the funds for open access publications.
Yeah, and then on a similar note as well, you mentioned a number of things, which I'm sure those costs accumulate pretty quickly. Is this something you would typically include in a single grant, or is it something like thinking about the larger context of open science, IKT? Is this something that typically would probably try to draw from multiple sources of funding?
Um, Both. That's like yeah, that's a difficult one. I think too. It really depends on the project and uh but for example, when you think about like visuals, you can like one of the things we've done now is we've worked with a graphic designer to create like visuals that we can use in different projects, or you can pay for like pictures, photos to illustrate documents, and that's yeah, you can use that in different projects.
Yeah, yeah, great. The next question was related to the e-learning course. Was that the original intention, is to develop an e-learning course when starting the research, or did that develop organically over time during the research process? So what did that look like?
Yeah, it was. it was a little bit of both. We were on a time, like it was a 2-year project. So, like the idea was to like we expected it would come out like we would expect to do an e-learning course, but it also aligned with what people want, but people also wanted to have practice opportunities. So because we also know like counseling skills, you don't learn them just by like going through an online course. Often you have to like practice, receive feedback, practice again. And within an online training module, there's no opportunity to, in our online training module, there's no opportunity to receive feedback on your counseling skills. So that was something different that people also want. But that was just not feasible within this project. So we decided that we focus on the online course now. And then and we just submitted a grant for do like additional practice counseling sessions yeah, for health and fitness professionals who are interested in yeah, like really practice their counseling skills. So
Yeah, absolutely. So sounds there's the what we want to do and then the realistic, like what can we do with what we have? And sometimes you have to build on that. Like it's a
yeah,
process, right? So
yeah.
um, yeah, so with that, we are coming up to time, and I don't want to keep anybody past their lunch period. So we're just going to do a few closing things. But before that, I hope everyone can join me in welcoming Dr. Hoekstra for a wonderful talk today. And that brings us to the end of today's webinar. Now, a reminder that a recording of this webinar will be available online from Michael Smith Health Research BC in the coming weeks at healthresearchbc.ca/KT webinars. Here you will also find 7 years worth of KT Connects content focused on knowledge translation skills and best practices. And we encourage you to watch and share this content within your networks as well. So we are going to be taking a little bit of a break for the summer with KT Connects. And on Friday, September 27th at noon, KT Connects will be hosting Dr. Kelly Colby. So Dr. Colby is a scientist at the University of Ottawa Heart Institute, an adjunct professor in the School of Epidemiology and Public Health at the University of Ottawa, and the co-chair of the San Francisco Declaration on Research Assessment, also known as DORA. A perfect person to continue our discussion on the intersection of open science and knowledge translation. You won't want to miss this talk. Please stay tuned for more information about this webinar, including registration in the coming days from Health Research BC. Thank you to everyone in this audience for your time and interest today. We hope that you found this talk as enlightening as we have. Your feedback is very important to us and will help improve future KT Connects webinars. A link to a brief survey will be launched immediately after the webinar ends today and will be sent to you by email as well. Please take 2 minutes to share your thoughts about this webinar and this open science series. Thank you so much in advance. And with that, we hope to see you next time. Until then, take care and have a great day and a great long weekend.